Healthcare IT Today. I'm John Lynn, together with my colleague and friend, Colin. The world of technology and healthcare are ever-changing in new and novel ways, and that's why we love this stuff. So join us as we discuss the latest healthcare and health IT news, meshed together in new ways, which help generate ideas and new perspectives. Plus, we'll have a little fun along the way. In today's episode, we'll be sharing insights from recent health IT virtual events. And be sure to follow the show on Twitter at the hashtag HITSM and our personal accounts at TechGuy and at Colin_Hung. Plus, check out our 14 years of health IT blog content at healthcareittoday.com. Well, you attended a few virtual events, Colin?
Yeah, 3 in the last just week alone. It's been crazy, just absolutely crazy. It's been a lot of fun too, but just a lot of video conference calls, a lot of, presentations online. It's been intense. It's been intense.
Yeah, I think I've hit 5 or 6 this month. And one of them, I said, I'm going to see how many Zoom calls I can do in a day. And it was somewhere around, I think it was around 10 that I tried to do with people. So
It's nuts. Yeah. On top of the 3 I went to, we did 2 of our own, right? Like we did our own expo.health event, or we did a HitMic event. And then, just so many conferences. We had health. We had MGMA's annual event, which was called MPEC 20 this year. We had Atlas event from Kairos. And then we had, what's the fourth one?
AHIMA as well.
AHIMA. That's right. AHIMA. Oh, geez, see? It's all a blur.
That is the problem. And, but I think there were some great insights that came out of the event and some interesting announcements. I think people are treating announcements a little bit differently, but I think there were a couple announcements that were pretty interesting. And of course, they kind of lead up into the events. But the ones that hit me was like Coro Health's announcement of the rebrand of their company. And I think they combined 6 companies, if I remember right, into one new brand. And so it's interesting they did it. And then another one was Providence Health rolled off, I think it's called Tigra, depending on if you do Spanish pronunciation or not. But, I think it was their new brand. And that was 9 companies that they were combining together. So I thought that was an interesting trend I saw as we led into these events, was these large companies coming together and forming these kind of super companies, if you will, that, I think it's going to be interesting, because how is that going to play out for a end user perspective? But from the same thought, like, the services that are needed by healthcare organizations, especially health IT services, but then you add in revenue cycle and other, call center services, et cetera, you kind of want to work with one vendor. So I wonder if this is the new evolution is, hey, I want someone who can do all of these things. Don't give me 7 companies that I have to work with.
Well, I think certainly just in general, healthcare wants to reduce the number of vendors that they deal with, right? You can see, we saw it in the med device space. We saw it in the consumable space. I'd rather just go with one rather than the 50 organizations individually. Yeah. So not surprising that we're seeing the same sort of movement on the IT side. So, which may be leading some of these companies to get ahead of the curve and say, okay, like I'd rather be the one rather than be consumed by one.
Well, and it's also private equity getting in, right? They're starting to throw their money around. So that will be interesting.
That's true too. But I agree with you. I think it's more around, I think a lot of people are realizing they need to provide a more comprehensive solution. So rather than doing the point solutions, they're getting together with someone who's adjacent to them. And that way they're offering more to the client. And frankly, in this time, this kind of uncertain time, it's probably a great way to mitigate your risk, right? If any one of these business areas goes down, you've now got 4 others that may be stable or actually rise. Whereas if you're a single solution provider, if that one particular solution isn't sort of a hot item for COVID, you're going to be kind of hosed, a Canadian term, for for a while. So it's a smart move. I think it's a smart move, and it was a pretty good announcement. I liked, Dalton and Patterson and company there at Coral Health did an amazing job with their brand. They launched that new website in a fairly quick manner, and their messaging was spot on. And AHIMA, which was where I won't say they debuted it, but where the big sort of coming out party happened. That's a lot of work to do in time for a conference that large.
Yeah. And I think your point's really well made around companies needing to diversify and make sure they're prepared for all the changes that are happening. I had a really interesting meeting with Patient Keeper, which they have this great charge capture solution. Doctors love it and all of that. But they were talking about a new solution they have, which is more of an analytics solution that looks at all your appointments, it looks at all your charges and says, hey, is there a mismatch? Like, did you not bill for something you should have? And, helps you identify revenue, which is a powerful thing to have. But it was interesting that Patient Keeper was doing that. But as I thought about it more, I'm like, oh, if ambient clinical voice really takes off the way I think it will, you don't need charge capture if the AI is doing it for you. So maybe Patient Keeper, and certainly they've got a while before this becomes reality, but they may have seen the writing on the wall and said, hey, we need to diversify what we're doing because ambient clinical voice could, eat up some of the charge capture. So I thought it was a smart move by them to move to some analytics as well.
One of the things I heard, and it was funny, was, you talk about announcements. The big news for me was actually, you're right, John. I don't think there was as many announcements tied to the events that we've seen when it was in person. I think, without the sort of draw of 100 or thousands of people together, I guess there wasn't that urgency to make a big splashy announcement when you had an online event. I think some companies did, and I think they were effective. But I think for the most part, these companies didn't sort of time their announcements. Whenever it was done and whenever they were ready, they did an announcement. And if there was an event at the time, great. If not, they still did it. So I asked a lot of the companies I met with at AHIMA and at MGMA's event, and they just didn't have anything that they did special for the event. They maybe had an announcement 3 weeks ago, or there was one that's sort of maybe coming down the pipe, but there was this sort of lack of announcements that happened at the event, which to me was sort of a bit of an eye opener.
Yeah, and it's interesting. Health, HLTH, their event, they try to puff up, 600 announcements or whatever the number is that they, that their companies are going to announce at the event. But I guess I've just always seen healthcare. I'm like, what would be an announcement that would really catch my eye and be like, wow, that's breaking news? Unfortunately for me, most of the announcements from these health IT companies is, oh, we're partnering. But like, is that really that big of an announcement? Okay, Epic partnered with Lyft. That's kind of cool and interesting, and that they're opening up. But like, the announcement becomes interesting in 6 months when they say, oh, we partnered and we did XYZ, right? We had this result. So I don't know. I'm just not on the, that there's big breaking news that needs to be announced. So, I think they're incremental movements, there's partnerships, and that's great, or maybe they get some certification or whatnot. But, 6 months from when they announce it is when the real interesting stuff is, where it's like, okay, you announced it, you partnered, but did you do anything together? Like, then I want to hear about it.
No, you're absolutely right. And we're kind of entering into HIPMIC territory here, but you're right. I mean, I think what this may be teaching some of us in the marketing world is, why do we tie all of the announcements to these events, right? Like, maybe if we just did it on a Wednesday 3 weeks before, we actually might get more play because nothing else is happening, right? Whereas instead, whereas we try to do it on the event, you've got 400 other people making announcements too. So it'll be interesting to see if that's a lasting trend or if there's any lasting impact on that. But certainly for me, it made my life a little bit easier because there wasn't sort of this rush to go and talk to people about all these announcements. We could really sit down and talk about business and talk about some of the things happening. And on that note, I met with Waystar, I met with Imagine, I met with a bunch of people at AHIMA. And it was really interesting what they were, and sorry, at MGMA as well. And the theme of telehealth came up, but it was telehealth back office. So, we've been writing about, John, a lot about telehealth on the front end side, like the adoption of the technology and so forth. But a lot of the people I talked to in the RCM world, the revenue cycle, were saying, hey, they were getting a ton of questions and a ton of concern from their customers about, how do I bill telehealth properly, right? How do I keep it from getting rejected? And on the other side, they're like, how do I make sure that I'm not going to be seen as like, doing something fraudulent, because it's going to look like my volume went from like 0 to like almost 100% telehealth, right? Which is sort of a bit strange, right? So they were feeling all these questions, and a lot of these companies like Imagine and like Waystar, we're having to kind of staff up or just really become the experts in this area in order to provide services and provide good advice to their customers, which I thought was very interesting because I never really, to be honest, never really thought about sort of these downstream impacts of implementing something like telehealth. And so they were experiencing this huge uptick in demand for this kind of expertise. And they've had to go and, of course, they've had to go out and learn it along with all of the rest of us.
Definitely. And I've seen some interesting trends in this regard, and it's kind of related to what you're talking about. And at the core of what you're talking about is, how am I going to get paid? And I think there's a lot of concern, and some of the MGMA stats and reports about how COVID has impacted practices is startling, right? But you look at that and you say, yeah, a lot of them are saying, okay, how am I going to survive? And how am I going to be able to thrive even in this world that's pretty challenging? Whether it's getting paid for telehealth, but I loved a solution I saw from MD Audit, and at first it was just a basic audit tracker, kind of filter by provider, then, give me a few records and let me show you that I audited it. Cool education piece. But then they showed me this bubble chart, which was, almost an analytics solution, right? Which I guess I'm a data nerd a little bit, but, like they had this bubble chart that showed the outliers who might be upcoding and we're at risk for some sort of liability because they're overcoding for the situation. And then also they had the ones in the bottom left that were the undercoding. Where can I get revenue out of people that might be undercoding? How should I audit maybe those undercoders so that I can generate more revenue for my organization? I thought that was another theme and healthcare trend that was really interesting to me, that, was really useful because it's, again, how can I get paid more for doing the things that, quite frankly, we're already doing, but, I need to maximize whatever revenue I can into my organization.
Yeah, and again on that theme, John, it's part of some of these online events that I got a chance to sit down with MGMA because they put out a study around better performers, right? And what are they doing that's different? What are they doing that's so impressive? And because they were better performers, according to MGMA, earned a significant amount of more revenue than the average practice. And ironically, what they have found was these people spend more on infrastructure, right? Spend more on IT, spend more on staffing, which is really counterintuitive when you think about it. They actually spend more, yet they make more. But it goes to what you just said there, where a lot of where these folks have spent is investing in people who really specialize in this revenue side, right? So the doctor is not doing the coding themselves. The doctor is not doing the submission of the claims and the processing of that, or figuring out how to do price transparency. They have a team of people, or maybe they outsource that. And that's allowed them to be more nimble. And to your point, it has allowed them to work with those kinds of partners, those that have made the investment, to make sure that they're maximizing the dollars that they are supposed to be getting, right? And they're not as overwhelmed as maybe someone who is doing it themselves, which I took as a really kind of a key insight there around revenue cycle from these better performers.
No, and I think that's interesting. They spent more, but they made more. And, they always say you have to spend money to make money. I think that can be overstated, especially in clinical practices sometimes. But I think it's more about the efficiency that they're doing. And they're able to spend more because they've created more efficiencies that allow them to make more revenue, which allows them to, obviously be more profitable, which is a great thing.
Hey, if you're just tuning in, you're listening to Healthcare IT Today with John Lynn and Colin Hung. And today we're talking about a lot of the trends and insights and interesting things that we've seen in a lot of the online events that we've been to recently. So John, let me ask you that question. What are some of the more interesting things you've seen, or the quotes, or interesting or kind of shocking quotes maybe that you've heard while we've been on these online events?
Yeah, so there was one that stood out to me thinking back at this and saying, that I'm still mulling on. And I think it was at MGMA, and I don't remember the reference of who, but it fits really well for MGMA. So it makes sense why they'd say it there. But they said, healthcare has been managing, not leading. And I thought that was just such a fascinating example of how many healthcare organizations have done it. In fact, healthcare is just so profitable because we need healthcare services. There's a certain level that we expect. We expect to pay a certain amount. There's demand because we all get sick, right? I mean,
Right.
so they've kind of almost taken for granted the idea that it's a business too. And
Mhm.
so they've just managed the patients, and they've been successful, and they've cared for them, and they've provided great services. But that's different than leading, which means how do we transform the healthcare industry? How are we prepared for all these changes to consumerization or things like that? So I thought it was really interesting about, managing versus leading, and how that's kind of how a lot of healthcare organizations have been run for quite a while.
I think one of the more shocking quotes I heard was from the MGMA MPEC conference. And it was from Michael O'Connell from Stanford Health, who, in a presentation that he was giving, basically said that they thought they would have a tough time recruiting new clinicians for a lot of the initiatives that they were doing. And it turned out that it was far easier than it had ever been. Which is really, really, that was shocking to me, because you'd think that during the middle of the pandemic, everyone wants to hold on to every physician, every nurse, every person they can. But it turned out that wasn't the case, that it was
Wow.
very easy for them to hire these new, very qualified clinicians for the roles that they had. And, he kind of, gave a couple of potential reasons. One, that, there were certainly some clinicians who were furloughed because if you were in the elective surgeries or elective procedures area, maybe those were canceled and postponed. And also, he was saying maybe this was sort of a time when people were actually reflecting back on to what they really wanted to get out of their careers, right? Having being locked in their house for so long, they kind of started thinking that way. So whatever the case was, he was very happy and was totally shocked and floored that this was the case. And I certainly was shocked hearing it.
Yeah, that is surprising. But yeah, I mean, I think COVID's caused a lot of us to ask a lot of questions. So I guess in that regard, it's understandable. I was thinking of one other, and I can't remember the exact quote, but they had a speaker at the MGMA MPEC event. And man, you should go watch her. She was fantastic around leadership and what leadership qualities are needed. And I mean, she was amazing. But she talked about one thing that leaders don't do is show humility. They feel like, okay, as a leader, I need to be perfect and I need to project this perfection and all is well. And I think she even said, don't get me wrong, you need to do some of that, right? Like you don't want to project that, hey, the business is failing and all that. But she said, take opportunities to be humble. She's like, so just in the next week, she's like, take a moment to go out there and say, where's something where I can say, I don't know how to do this. Will you help me, to your team? And she's like, it's amazing how powerful that is, because it shows trust in your team. It shows that that you're human, and that you're willing to listen, all those things, right? So anyway, that was an amazing session as well.
No, speaking of leadership, I was at the Axis Atlas event put on by Kairos, and they had Admiral McRaven as their keynote. And of course, he's the guy who was in charge at the time when they took down Osama bin Laden, and they
Okay.
captured Saddam Hussein, right? And
Yep.
so he talked about leadership and being a Navy SEAL, and he very similar things to what you just said, John. That the opportunity for a military leader to show humility, to know that what the rank and file has gone through, they've gone through, was very powerful and a very great way for the military to connect. And he talked about at length about all the different ways that they go through in training to basically build that teamwork. And his message to the folks that were listening, of course, was, hey, you don't have to obviously go neck deep in the mud for 3 days in order to learn how to work together.
Although that works.
Although apparently it works really well, apparently. What he was basically saying is that in healthcare, you're already doing that. Like every day you're in the mud together,
That's a good one.
helping out. And that was sort of his analogy. And I thought that was really powerful. And so it wasn't shocking. It was just more like, wow, like, I guess really, we obviously, those people who are working on the front lines, they probably felt it certainly during COVID, but on a day-to-day basis, I'm not sure they would equate what they do to what a Navy SEAL does. But the retired admiral basically made that analogy to say, oh, I think it's very similar, right? You're using the skills, you're practicing at the top of your games. It's exactly what we teach our guys in the military to do. So I thought that was pretty cool. And
Yeah, I think you and I should go hike Mount Kilimanjaro. That would be a good way to humble both of us.
yeah,
A nice shared experience, which ironically, I actually pulled that from your session that you moderated at MPEC. One of your speakers said, because I think you asked, what are you doing during COVID to kind of de-stress, which that was an interesting trend of these virtual events. I saw it in a number of different ones where it's like they switch gears and say, how are you surviving? Like it didn't,
right.
like you were talking about marketing, you're talking about rev cycle, and then you're like, what are you doing to de-stress? And you're like, oh, we all want that too. So it was kind of cool. And you guys did it in your panel, and she was going to climb Mount Kilimanjaro. So she's getting out and hiking. But, I think those type of experiences do show good leadership. They, do bring people together and bond in a way that's pretty unique. So, and I think that's, as we talk about virtual events and kind of wrap up this episode, virtual events have a challenge because you don't have that shared experience the same way you do if you're in person and 20,000 people, 10,000 people in a room kind of feeling the same vibes, going to the same dance party, feeling the exhibit hall. So you don't have those bonding. So to me, that was one of the challenges of virtual events, I think. And interestingly enough, as I did these different virtual events, I like craved the face-to-face, the unpredictable, if you will. And so every opportunity I had to get on a Zoom call with an exhibitor or to, engage with a human rather than just listen to education, which there's nothing wrong with good education, but every opportunity I had to engage with a human, I was excited to do because I craved that connection and I craved that unpredictability and the randomness of it that, usually happens at an in-person event. And so I was, and there were some that were good. I mean, props to AHIMA, their platform told you when there was a human there, and I would go hop in and talk to some people and had a great experience that way.
Yeah, I had the same with the MGMA event. It was really nice to be able to connect live to some of these exhibitors and sponsors in their sort of virtual exhibit hall, and just being able to talk to them again one-on-one or one-to-many. And yeah, it was people got notified when you knew someone was there. So it was similar to being at a booth. I did enjoy that. I
Did you
also
have
enjoyed.
any where you joined in and then they're like, you know what? And then someone else would join in and they're like, oh, by the way, this is Steve. He's our expert on whatever you were just talking about. Like I had that happen once or twice. I was like, that's kind of cool because if I was in person, I go to a booth and I'm like, tell me about your EHR product. They're like, oh, they're not in the booth. Sorry. Can we send you later? But in
Yeah.
this case that, you can tell in the background, they're typing and sending a message. Hey, Steve, will you hop on the Zoom? And then Steve comes on and answers my question. So that part was pretty cool, actually.
Yeah. Although I think, John, for you and I, what more often what happened was the PR person showed up, right? Right. Like, oh no, I can't talk to the press. I got to bring my PR person in. But no,
There
I
was
mean,
a
it
few
did happen
times.
to me a couple of times there. But I like that. I think for me, I think I came to recognize that the speakers who really over animated, who I guess if you saw them in person, you would go, man, they're hamming it up. But on a interface like this, I felt they needed to do that. Otherwise, it wasn't enough. Like if you just stood up and presented, or even sat and presented it in your normal voice, in your normal way, it probably wasn't enough to kind of drive that energy. It takes so much more energy to do what you need to do online versus in person. So I found that was sort of my takeaway from this. And so for that reason, I think a lot of the sessions, they came off a little bit, a little
Well,
bit
flat.
bland, a little bit like down a little bit. But there were some really amazing speakers throughout all of them. A couple at AHIMA, a couple at MPEC, a couple at Kairos, certainly, where you could tell they were over animating themselves. And it made a huge difference for me. And I thought that was really cool. And I also liked some of the other unique things that some of the people were doing. Like they had that trail map thing that they were doing at MGMA. They had the interactive mural that was
Yeah, that
happening.
was cool.
I thought that was cool, and there were some really cool networking things that that Kairos did, where they actually did a penguin feeding that they
Oh,
showed
really?
online. That was their break, right? They actually went to it was the aquarium there, and they actually tapped into the feed, and they did a special feeding for people watching. And it was so relaxing to watch them feed penguins. It was awesome.
I love
So
the
like,
penguin
so
rooms.
creative, right? So I like that. I like that. That was really fun to be there.
Yeah, you're so right about the energy of the speaker, though. It makes so much difference. That, and to me, that's the description, is what's the energy that they bring. I think that's so powerful. It was interesting too. During the HEMA one, they had a chat room next to each of the sessions, and the HEMA people were just going off in the chat room. It was really amazing, to see them interacting and engaging, making jokes, all sorts of, sharing resources, all sorts of things like that. And at one point, someone said, can we have chat rooms at in-person events in the future when we go back to in-person events? And I just thought to myself, man, Colin and I have been doing this forever on Twitter, because that's essentially what we have with the hashtag for our conference, is a chat room with a bunch of really smart, cool people. And Nahima finally discovered it because they put it next to it, right? And so, it's like, oh, well, and I commented, I said, just hop on the Twitter hashtag, and that's essentially what you get. And but it was cool to see them discover it and realize, yeah, it is so much more fun. An event that doesn't have the back channel is almost annoying to me now because we've done it so much. But it was cool to see kind of their discovery of that and being able to experience this bimodal learning and connection that you and I take for granted I guess.
Take for granted, yeah. No, for sure. So much. For sure. And that happened during the panel that I did for MGMA, right? Like you just see the chat just blow up when some people were making amazing comments, and yeah, all I could think of in my head was, boy, this should be on Twitter so that the world can see it, not just the people at the conference, right? Yeah. Or just not the people who were just in that one session. So, but yeah, hopefully that'll be the first taste for these folks to get on the real Twitter and get into connecting that way.
Yeah, and I'll throw in one more thing that's a little different. It's interesting about your penguin thing. I think that's actually much more interesting. But I actually didn't participate in many of the social ones, and I really wanted to. But I think with the time zone change, it's just weird, because if they're doing a 6 p.m. social event, that's 3 p.m. for me on the West Coast. And so it's like, wait, so I'm supposed to get into DJ mood at 3 p.m. I don't know. The timing screwed me up. I don't know. That was hard. But so I kind of missed some of those things so I don't know how well they went because the timing was weird. But, other than that, I mean, it was still great to connect with people and see people.
Yeah, it is fun. I think, all of us, and especially the organizers, are really just feeling their way and they're learning. And I think, these being much later than the early stages of the pandemic, I think they've learned some good lessons here and they tried to apply them. So I applaud all of the organizers, AHIMA, MGMA, Kairos, and Health, for trying and experimenting with some of these things to try and keep people engaged and socializing and networking. And I think hopefully it just bodes well for online events in the future.
Yeah, 2021 it's going to be better online either way, but hopefully we're back to in person.
And John, hey, we're at the end of another episode here of our podcast and our episodes. So thank you to all of you who tuned in to this episode of Healthcare IT Today. You can find out more details about our show by checking out the programs page at healthcarenowradio.com. And please share your voice and engage with the community at healthcareittoday.com or on Twitter using the hashtag HITSM. I'm Colin Hung, along with my friend and health IT collaborator, John Lynn. Thanks for listening and have a great week.